My name is Cliff Robinson. I'm a radiation oncologist at Washington University in St. Louis. I'm a professor of radiation oncology, where I'm chief of the cardiothoracic radiation oncology service, and as well as director of clinical trials. Whole brain radiation is known to cause neurologic deficits, particularly in regard to short-term memory and recall. Now, each part of the brain has its own responsibilities, and as we've discovered over the years, the deficits in short-term memory and recall are primarily related to the hippocampus. The hippocampus is that medial part of the temporal lobe on either side of our brain that's required to take these early memories and get them into longer-term memory, amongst other activities that it's responsible for. Now, people present with different size hippocampi, different function of hippocampi, and we've known over the years by looking at the Alzheimer's literature and the mild cognitive impairment literature that there are people who are more or less susceptible to damage in these regions. But what has become clear over the years is that the radiation dose to the hippocampus is also related to dysfunction in those effects of the hippocampus, including short-term memory. So as a consequence, several years ago, primarily from work within the group at Madison, Wisconsin, Vinay Gandhi and others, they developed a way of delivering whole brain radiation treatment while avoiding treating the hippocampus, or at least minimizing the radiation dose to the hippocampus. Now, this does require a somewhat more complicated whole brain radiation technique, typically with something called intensity modulated radiation therapy. So it's a more involved treatment than standard whole brain radiation treatment. However, the early results of these trials have been interesting and significant. The first trial demonstrated, compared to historical controls, that there was a significant reduction in the rate of short-term memory and recall issues in patients who received hippocampal avoidant whole brain radiation. It's now been directly compared against standard whole brain radiation in a clinical trial called NRG-CC001, and it showed that there was a significant reduction, again, in the rate of neurologic complications in those who received hippocampal avoidant whole brain radiation treatment without at any expense an increased risk of brain failure. That's been a concern that people have had all along, which is that if you reduce dose to that region, that you may suddenly notice a very large increase in the rate of hidden brain metastases in that area. And while we've seen a slight increase numerically, most of those patients can then go on to receive salvage treatment with radiosurgery. This same principle is now being tested in the prophylactic cranial radiation zone through the NRG-CC003 trial, which recently completed as well. So this is a great example of the testament of a borrowing information from another field, that is the Alzheimer's and mild cognitive impairment field, applying that rationale to a patient population in need, and then being here at the right time and the right place when the technology finally exists to deliver this. Now, there are exceptions to the rule for patients who may or may not benefit for whole brain radiation using this technique. First of all, and perhaps most obviously, in those patients who have brain metastases within the hippocampal zones, hippocampal avoidant radiation is inappropriate. The doses that go there are insufficiently high to sterilize disease. And so those patients who present with an MRI with lesions within or within a few millimeters of the hippocampus, this is not an appropriate treatment. The second issue is resources and time and cost. Because it's delivered with IMRT, or intensity modulated radiation therapy, it is a more costly treatment. And so there is a current question within the payer community as to whether this is a reasonable treatment given the fact that it does cost more. Now, we'll have to wait for those types of cost-benefit analyses to weigh out over time, and they ultimately may become irrelevant in a bundled payment type scenario. But there's no doubt that it does require increased resources. So our group and others are working on increased tools and automation to make this a simpler and easier treatment, particularly for those patients who live around the world who may have less access to modern radiotherapy equipment. So in short, hippocampal avoidant whole brain radiation is a treatment that was quite early and scientific and ultimately experimental years ago, but is now rapidly becoming part of our usual armamentarium in those patients who require whole brain radiation. either for intact brain metastases or prophylactic cranial radiation.